Hi, my name is Dr. Grady Moore, and I'm one of the OB-GYNs here in Wichita Falls. I'm coming to you live right now from my office inside the Women's Clinic. And since January is Cervical Cancer Awareness Month, I kind of wanted to talk a little bit about cervical cancer screening and possible prevention. Now, before I start, a couple of different things. Number one, this is my very first Facebook Live video. In fact, I don't even have a personal Facebook account, so I apologize in advance for my nerves, and I also apologize if I start talking too fast. Number two, the information that I'm giving today is very general, so by no means should it substitute a face-to-face encounter with you and your doctor, okay? So if after the video you have questions that are specific to you and your situation, I really recommend that you either follow up with your doctor, and if you don't have a doctor, please call us here at the Women's Clinic, 723-8151, and we'd be happy to establish an appointment with you. Okay, let's get started. So, cervical cancer. According to the American Cancer Society, in the year 2018, about 13,000 new cases of cervical cancer will be diagnosed. And of those 13,000 cases, about a little over 4,000 women will die from the disease. Sadly enough, cervical cancer used to be one of the leading causes of cancer death among women. Fortunately, though, that has changed. And that is largely due to us now doing more regular screening. And how do we screen for cervical cancer? It's by your doctor doing a test called the Pap smear. And I wanted to talk a little bit about the Pap smear today. But before I talk about the Pap smear, I think it's important that I talk about the differences between a pelvic exam and a Pap smear, just because that seems to cause a little confusion for some patients. Now, with a pelvic exam, your doctor is going to visually inspect the external genitalia. Then they're also going to use this little device here called a speculum, or the duckbill thing that patients like to call it. And we're going to take a look at your cervix, your vagina, your urethra. If you still have your uterus and your ovaries, your doctors may do something called a bimanual exam, and that's where we actually use our hands to gather information about your uterus and your ovaries. Now, how does that differ from an actual Pap smear? Now, with the Pap smear, again, we use the duckbill thing, but your doctor is also going to use something called a spatula, and then also something called a cytobrush. And with that, we get cells from your cervix. Now, those cells are then looked at underneath a microscope by a pathologist to see if there's any abnormalities. Okay, so slight differences between that. Now, who needs a Pap smear? Now, when I first started training, we started doing Pap smears on people 3 years after they started having sex. No longer is that the case. All women will start having Pap smears. You need to have a Pap smears when you're 21. This is regardless of when you started having sex. It's also, even if you want to start on birth control, you do not necessarily have to have a Pap smear. Now, the exceptions to starting at age 21 would include women that are HIV positive, immunocompromised, or if your mother was, when she was pregnant with you, was exposed to a medicine called DES, which is something we stopped using in the 70s, then you would probably need to start Pap smear screening a little bit earlier, okay? So we typically start at 21, and those women get Pap smears every 3 years if it's normal. Now, those are, women from the age 21 to 29. Women between the age of 30 and 65, you can have a Pap smear every 3 years, or you and your doctor can also choose to do something called co-testing, and that's where they test for HPV, or human papillomavirus. If that and your Pap smear are negative, you only need a Pap smear every 5 years. So, wait a minute, Dr. Moore. I only need a Pap smear every 3 to 5 years, depending on my age. Then why am I getting undressed every year? Is what the question is. A question that patients ask me. And if you remember earlier, I said there's a difference between a pelvic exam and a Pap smear. So even though you may only need the Pap smear every 3 to 5 years, your doctor is still going to probably do a pelvic exam every time you come see them. Okay. Now, when do we stop doing Pap smears? Typically, 2 things is when you start doing Pap smears. If you've had a hysterectomy, removal of your uterus, and also removal of your cervix for a reason other than abnormal Pap smears, you had fibroids, you had pelvic pain, heavy vaginal bleeding, you can stop doing Pap smears. You won't need a Pap smear for the rest of your life. Or if you get to the age of 65 and you've never had what we call moderate or high grade dysplasia, you can stop having Pap smears at age 65 as well too. Now, it's important to note that sometimes your doctor may do a hysterectomy, but you may still have a cervix, and that's called a supracervical hyst. If that's the case, you still need to do regular pap smears until you're 65 years old. Now, earlier I said that you can stop having those as long as you haven't had something called moderate to high-grade dysplasia. How would you know that? So whenever your doctor does a pap smear, we follow something called ASCCP guidelines. And what that does, it takes into account your age, it takes into account your pap smear result, and your HPV result if that's known. And that lets us know how do we need to handle your pap smear if it's abnormal. A couple of things that your doctor may do if your pap smear is abnormal is something called a colposcopy. That's where we use a high-powered type of microscope to look at your cervix, and we may or may not take biopsies. And you may also need another procedure called a LEEP or something called a cone. And in both of those procedures, we take pieces or portions of your cervix either for further evaluation or sometimes even for treatment. Now, women that have had high-grade or moderate dysplasia, they will need pap smears for 20 years after that diagnosis. That's irregardless of whether you had your cervix removed or if you're 65. You still need pap smears for another 20 years later. Now, let's talk a little bit about prevention. Earlier, I talked about HPV. One of the things that you can do to help decrease your chances of getting cervical cancer is getting the HPV vaccine, or something called Gardasil. Gardasil, what it does is it helps protect you against certain types of HPV that could cause genital warts, but also certain types of high-risk HPV that can cause up to 90% of cervical cancers. Okay, it's indicated for girls between the ages of 9 and 26, but the optimal time to get it is between the ages of 11 and 12. It's 3 shots you get over a 6-month period. Now, if you're a female that got the shot before your first shot before your 15th birthday, you actually only need two-dose regimen. Okay. Now, a couple of different things about HPV. Number one, you can get it even if you've been sexually active. 2, if your doctor told you that you had HPV in the past, you can still get the Gardasil vaccine. There's over 150 types of HPV, and even if you've tested positive before, the vaccine may still give you a little bit of benefit. 3, just because you got the HPV vaccine doesn't mean that you don't need routine screening. You still need routine pap smears according to your age and your situation. So I definitely want to encourage either patients to get their vaccines, or encourage your daughter and your son to get the Gardasil vaccine to help protect against cervical cancer. Now, all that information that I gave is good information, and what I want patients to realize is that cervical cancer, as with any other type of cancer, is going to be best treated if it's detected earlier. Now, if you have any questions later on, I'll be happy to answer them, or like I said, you can always call us here at the Women's Clinic and set up an appointment.